Hydroxyzine is a prescription antihistamine vets may use in dogs for itching, allergies, hives, and other allergic symptoms. It blocks histamine H1 receptors, helping reduce itching, swelling, redness, runny eyes, sneezing, and hives. Hydroxyzine is used off-label in dogs, so the correct dose depends on weight, condition, health, and other medications. The general dosage is 1 milligram per pound, or about 2 milligrams per kilogram, given up to 8 to 12 hours. For example, a 50-pound dog would equal 50 milligrams using the general 1 milligram per pound guideline. Hydroxyzine may be given as a tablet, capsule, or liquid, and usually starts working within 1 to 2 hours. The most common side effect is drowsiness. Dogs may also experience dry mouth, thirst, constipation, or stomach upset. More serious reactions can include severe sedation, weakness, seizures, or trouble breathing, requiring immediate veterinary attention. Extra caution is needed with seizures, glaucoma, heart or lung disease, and severe liver or kidney problems. Never self-dose or combine medications without veterinary guidance. Follow your veterinarian's exact instructions for your dog. For a dosage calculator, detailed benefits, potential side effects, which dogs should avoid this medicine, and safe serving ideas, visit our website through the link in the description.